सतर्क रहिए।
Come on boys, let's go practice.
अरे रुक यार, मेरे बैंक अकाउंट में गलत एंट्री का प्रॉब्लम हो गया है।
अरे तो बैंक को कंप्लेन करना।
बैंक को लिखे 1 महीना हो गया है, बट वो गूगली पे गूगली डाले जा रहा है।
तो आरबीआई के बैंकिंग लोकपाल को इन्फॉर्म करो।
रुक मैं समझाता हूँ। जैसे क्रिकेट में थर्ड अंपायर, वैसे ही आरबीआई का बैंकिंग ओम्बड्समैन। आरबीआई कहता है अगर बैंक आपकी कंप्लेंट को 1 महीने में नहीं सुलझाता तो आरबीआई के बैंकिंग ओम्बड्समैन में कंप्लेंट करो। यह आरबीआई का आसान तरीका है आपकी कंप्लेंट सुलझाने का, और वो भी फ्री।
समझे?
आरबीआई कहता है जानकार बनिए, सतर्क रहिए।
सीधे खातों में आ जाते हैं आसानी से। बैंक हमारे दरवाजे तक पहुंच जाता है, वेरिफिकेशन भी हो जाता है आसानी से। इसीलिए कहते हैं भैया
आधार अपना लो,
फायदे में रहोगे।
हर घर की एक कहानी होती है, और कहानी में कहीं ना कहीं एक घर होता है। ये होती है आपकी, आपके रिश्तों की और आपके परिवार की। ये आपकी कहानियों का घर है। अपने रिश्तों को और सुंदर बनने का मौका दें। आपके और आपके परिवार की खुशहाली के लिए LIC हाउसिंग फाइनेंस दरख्वास्त करता है। घर में रहिए, सुरक्षित रहिए।
पक्की होगी बुनियादें तो हंसे हिंदुस्तान होगा। पहले करो शुरुआत करो, करो तो पक्की बात करो। पहले करो शुरुआत करो, करो तो पक्की।
वनडे सीमेंट, एक परफेक्ट शुरुआत।
दुनिया में कई काम बड़े मुश्किल हैं, जैसे कि चंद मिनटों में चांद पर पहुंचना, टूथपेस्ट में पेस्ट को वापस डालना। और भैया एक काम है जो है बेहद आसान। अरे भाई वही आधार कार्ड में अपना एड्रेस अपडेट करना। इसके लिए बस आपको UIDAI की वेबसाइट पे जाना है, अपना आधार नंबर डालकर OTP जनरेट करना है, फिर फॉर्म में OTP डालकर अपडेट एड्रेस कर कंफर्म करना है, और लो हो गया आपका आधार में एड्रेस अपडेट। आप भी आधार अपना लो, फायदे में रहोगे।
In this episode of Corona Warriors, we're going to get you some exclusive news elements as to show you how these men in uniform from CRPF are also Corona Warriors in true sense.
जो भी जवान ड्यूटी से आता भी हो जाता है उसे भी सैनिटाइज किया जाता है।
हाइपोक्लोराइड लिक्विड इसमें रखा है जिससे सैनिटाइज किया जा रहा है, and there is a motor also attached to it. Even when the CRPF jawans take their positions or seats in the bus, there is a proper drill. They call it busing and debusing.
जरूरतमंद गरीब लोगों को प्रत्येक के हिसाब से 2 मास्क उपलब्ध कराते हैं।
पर्सनल प्रोटेक्टिव इक्विपमेंट, इट स्टार्ट फ्रॉम द हेड टू टो।
100 से 150 तक बना देते हैं। बार बार यूज कर सकते हो, एक बार फिर इसको धोने से भी ठीक है, ये खराब नहीं होता है कपड़ा में।
बाहर जो गरीब डाउन ट्रॉडन है, जो स्लम क्लस्टर्स में रहते हैं, क्योंकि वो महंगे मास्क बिल्कुल अफोर्ड नहीं कर सकते,
हिंदुस्तान एक ऐसा मुल्क है, अनेक प्रकार के लोग रहते हैं, बहुत से अलग अलग मजहब है, अलग अलग जाति है, और अलग अलग हमारा पोशाक है, अलग अलग हमारी जबान है। ऐसा कोई मुल्क दुनिया में नहीं है हमारा काम ये है कि हम
Good evening and welcome to our special show on the coronavirus. I'm Amrit Pal Singh. This is a special broadcast, hashtag tracking COVID-19 here on DD India, which is your one-stop destination for all information related to COVID-19. And it goes without saying, we at DD India are taking particular care to give you the accurate, authentic and authoritative information so that you do not fall prey to rumors or fake news. Wherever you are in the world, wherever you might be, it is in your interest, remember, to follow the government advisories, protocols or guidelines issued by authorities concerned, So stay safe, stay at home, maintain social distancing, use masks and gloves, and most importantly, wash your hands regularly with soap. Let's get started now. First up, the headlines. Health Ministry clears the air, says no community transmission in the country. Nobody needs to panic. Awareness and alertness is a must. Home Ministry directs all states and union territories to ensure strict compliance of lockdown measures to fight COVID-19 and not allow any social or religious gatherings or processions. The centre says it has enough stock of hydroxychloroquine. India has released surplus for export only after keeping a sufficient buffer for its own requirement. Assures there is no dearth of N95 masks and PPE for domestic requirements. PMO reviews efforts of 11 empowered groups towards tackling COVID-19. Confidence-building measures key to ensuring seamless supply chain management, communication in regional languages to remain the focus. Prime Minister Narendra Modi speaks to his counterparts in Japan and Nepal on the prevailing situation due to COVID-19, also speaks to Brazilian President, and the Israeli Prime Minister says India is committed to contribute to humanity in humanity's fight against COVID-19 pandemic. And COVID-19 claims more than 96,000 lives across the globe with more than 16 lakh cases. Spain records its lowest daily death toll from coronavirus in 17 days with 605 deaths in a day. Union Health Minister Dr. Harshvardhan today held a video conferencing meeting with state health ministers to review actions and preparedness of states to manage COVID-19. Minister of State for Health Ashwini Kumar Chaubey and senior officials of the ministry were also present in the meeting. Briefing the media, he said that 4,100 crore rupees has been released to the states in this regard.
विशेष रूप से सुविधाओं को और ज़्यादा स्ट्रेंथन करने की दृष्टि से कोविड के खिलाफ लड़ाई को और मजबूत करने के लिए 15,000 करोड़ रुपए का एक हेल्थ डिपार्टमेंट के लिए पैकेज उसकी घोषणा की थी। मैं ये आपको बताना चाहता हूं कि उसमें से 4,100 करोड़ रुपया ऑलरेडी हम सभी स्टेट्स को रिलीज कर चुके हैं। पैसे के कारण किसी भी प्रकार से कोविड के खिलाफ जो हमारी जंग है उसमें कोई कमी नहीं आनी चाहिए, ऐसा हमारे प्रधानमंत्री जी की भी इच्छा भी है, उनका निर्देश भी है और उसके अनुरूप उन्होंने हमें हेल्थ डिपार्टमेंट को सहायता भी की है।
Dr. Harshvardhan said that Health Ministry has issued advisory to deal with the hotspots and implement lockdown properly.
काफी हद तक स्थिति को कंट्रोल करने में सफल हुए हैं। कुछ स्टेट्स के अंदर जरूर बीमारी थोड़ा सा असाधारण गति से आगे बढ़ रही है, लेकिन अभी लॉकडाउन के हम तीसरे सप्ताह में हैं। साधारणतः जो एपिडेमियोलॉजिस्ट का भी कहना है कि 2 से 4 सप्ताह तो इसके कर्व को फ्लैट होने में नॉर्मली भी लगता है। इसलिए हम जरा भी धैर्य को ना खोएं, परिश्रम के में कोई कमी ना रखें। जो टेक्निकल एंगल से जितने भी हमारे इनपुट्स हो सकते हैं उसको गहराई से हम करें, हर विषय पर पैनी निगाह रखें। और अब जबकि देश के अंदर स्वास्थ्य मंत्रालय, एनसीडीसी और सब प्रकार के एक्सपर्ट्स के माध्यम से हॉटस्पॉट्स को लोकेट कर दिया गया है, लेबल कर दिया गया, उनके लिए स्ट्रैटेजीज डिफाइन कर दी गई हैं।
There is no community transmission of COVID-19 in the country till now. In a daily briefing, Joint Secretary of the Health Ministry, Love Agarwal, said that no local transmission has been traced, but we have to be on alert and follow the do's and don'ts.
रेस्पिरेटरी इलनेस के केसेस की रैंडम सैंपलिंग अगर देश में की है तो उसमें करीब 1.8% केस पॉजिटिव आए हैं। तो इसमें आपको ये समझना होगा कि ये 1.8% पॉजिटिव जो केसेस आए, दीज आर फ्रॉम द आवर वीआरडीएल लैब्स। जो हमारी वीआरडीएल लैब्स प्राइमरली उन्हीं एरियाज में लोकेटेड जहां पर ऑलरेडी केसेस पाए जा चुके हैं। इस स्टडी में आपको कहीं पर भी ये नहीं लिखा है कि ये ऐसे एरिया में आया जहां सिंगल केस भी नहीं पाया गया, तो ये उन्हीं एरिया में पाए गए हैं जहां केसेस पाए गए हैं। वेरी फैक्ट कि अगर ये स्टडी इंडिकेट करती है कि कुछ पर्टिकुलर केसेस में कॉन्टैक्ट की ट्रैवल हिस्ट्री नहीं है, कॉन्टैक्ट हिस्ट्री नहीं है, तो इट ओनली नीड्स फर्दर इन्वेस्टिगेशन कि हम उसकी कॉन्टैक्ट हिस्ट्री को फर्दर लोकेट करें। और साथ में जैसे आप लोगों की नॉलेज में इससे पहले भी मैं बता चुका हूं, कुछ हमारे एरियाज हैं जहां केसेस का नंबर थोड़ा बढ़ जाता है, तो उन केसेस में कई बार कॉन्टैक्ट ट्रेसिंग सही ढंग से हो नहीं पाती। तो फिर मैं आप लोगों की दृष्टि में लाना चाहूंगा, देश में अभी कम्युनिटी ट्रांसमिशन नहीं है, उतनी भय की स्थिति नहीं है, लेकिन फिर भी हमें अवेयर रहना है, हमें अलर्ट रहना है और रिक्वायर्ड डूज एंड डोंट्स को फॉलो करना है।
The Joint Secretary also assured that there is adequate availability of hydroxychloroquine in the country. He said that India has stock of 3.28 crore hydroxychloroquine tablets.
लोगों ने जो प्रोजेक्शन किया उसके हिसाब से जो हमारे क्लाइंटेल है इन टर्म्स को जिनको हमें ये पर्टिकुलर दवाई देनी है, वह है हेल्थ वर्कर जो कि कोविड पेशेंट से डील कर रहे हैं, जो आईसीयू केसेस से डील कर रहे हैं और जो फर्स्ट लेवल ऑफ हाई रिस्क कॉन्टैक्ट्स हैं जो कंफर्म केसेस के हैं। तो उनके लिए हमने जो प्रोजेक्शन किया तो हमें करीब 1 करोड़ टैबलेट की जरूरत होगी जो आने वाले एक हफ्ते को अगर आप मिलाएं, और हमारे पास आज भी 3.28 करोड़ टैबलेट्स अवेलेबल हैं। यह मैं आप लोगों की दृष्टि में इसलिए लाना चाहता हूं कि जितनी हमारी प्रोजेक्टेड रिक्वायरमेंट है इस टाइम, उसके 3 गुना से ज्यादा टैबलेट देश के पास आज डोमेस्टिक यूज के लिए अवेलेबल हैं। इसके साथ ही एडिशनल रिक्वायरमेंट अगर हम मंथ एंड तक प्रोजेक्ट करें तो उसमें करीब 1.6 करोड़ टैबलेट्स की अगर जरूरत होती है तो 3.28 करोड़ तो हमारे पास ऑलरेडी आज अवेलेबल हैं जो कि हमारी मंथ एंड की रिक्वायरमेंट को भी पूरा करेगी। उसके अलावा भी 2 से 3 करोड़ एडिशनल सप्लाई का टाई अप करके देश के लेवल पर रखा गया है।
And a meeting of the empowered group of officers to tackle the challenges emerging as a result of spread of COVID-19 was held on Friday under the chairmanship of the Principal Secretary to Prime Minister. The meeting was the latest in a series of periodic reviews at various levels by Prime Minister's office to monitor the ongoing efforts to counter the impact of the pandemic. The issues related to the supply chain and logistics management for availability of necessary items, efforts undertaken for benefit of stakeholders involved, steps to assist farmers to harvest their produce while maintaining social distancing, further confidence building measures needed to ensure percolation of guidelines of the Ministry of Home Affairs to the ground level. All chief secretaries of states issued instructions to arrange for shelter for vulnerable groups like migrants and homeless. The centre is in constant touch with the states and district level monitoring is being undertaken. The production of PPEs is being ramped up for capacity building for healthcare personnel, and that's being ensured. NGOs and civil society are also being mobilized. Progress of rollout of welfare measures through economic relief package under the PM Garib Kalyan Yojana or the Pradhan Mantri Garib Kalyan Yojana. The Principal Secretary also underlined that data sanctity was important to ensure that the benefits reach out to all the intended beneficiaries. Steps are being taken to ensure timely information's dissemination throughout the country. These were the various issues that were discussed in this empowered groups. And let's now take a look at what all has been done till now, how India is fighting the pandemic. 20,473 foreign nationals have been evacuated till date. That's the number of people who have been evacuated. 35,000 relief camps have been set up across the country. This includes all the various states. This is done by state governments, NGOs, the centre. 146 testing labs are there in the country operational right now. 16,000 collection centres are there in the country. About over 16,000 tests have been done just in the past 24 hours. The Health Ministry has said that the rate of infection is very, very low. As the Minister himself was saying and the Joint Secretary was saying, there's no community spreading as of now. Infection rate is low. The infection rate, in fact, yesterday was only 0.2%. 1,44,000 tests have been done till now across the country. That means these many people have been tested. The Health Ministry says there is no community transmission in the country as of now. And 14 million tablets of hydroxychloroquine are to be exported. The government took this decision. 13 countries have been cleared for these exports for the supply in the first list. The countries which are in that list includes to which these tablets will be exported are US, Spain, Germany, Bahrain, Brazil, Nepal, Bhutan, Afghanistan, Maldives, Bangladesh, Seychelles, Mauritius, and the Dominican Republic. So these are the countries that India will be exporting hydroxychloroquine tablets to. The government's made it absolutely clear that the government has enough supplies to meet the local demand. Now let's take a look at how the world is battling the COVID-19. Well, it's an alarming situation world over. More than 16 lakh cases, confirmed cases worldwide. These are figures as of this evening at about 7 o'clock in the evening. 4,66,299 cases. That means over close to about 4,70,000 cases in the US, about 1,57,022 cases in Spain. These are cases which are tested positive. 1,43,626 cases are there in Italy. Active corona cases. In France, there are 1,18,785 cases, and in Germany, 1,18,235 cases. So that's what the situation is. Let's take a look at the number of deaths. Well, more than 96,000 deaths worldwide have taken place. In the US, the figure has crossed way above 16,000. US is number 2 in number of deaths. Italy still tops the list. It has 18,279 deaths, but at the rate which the US deaths are increasing, it looks like US will overtake Italy. I mean, there will be more deaths. In Spain, there have been more than close to about 16,000 deaths, 15,843. These are figures till about 7 p.m. And well, the good news, the silver lining really is that many people are recovering as well. 3,61,377 people. So more than, close to about quarter to 4 lakh people have recovered also from this virus. So you can recover from this virus. The best way is to avoid getting the virus. That we've been telling you, maintain social distancing, stay at home, quarantine for the people who have symptoms, go to a doctor, quarantine yourself, get yourself tested. Do not hide if you have these symptoms. Go get yourself tested. There are enough labs in the country right now doing tests. More importantly, maintain hand hygiene. Wash your hands regularly with soap. Use sanitizers. Use masks and gloves. Avoid getting this or contracting this infection. That is the best way to avoid it. Well, let's take a look at this story. Our correspondent Momita Biswas gets us this report from Kolkata.
Today is the 17th day of lockdown, and you can see beside me the roads are completely deserted. The shops are even closed. The shops and daily necessity items are only opened as the list given by the government. Currently, we are at the bazaar called the Gariya Bazaar. This is normally, in the normal time, the bazaar is very chaos, but currently it's completely deserted as people are following the rules and regulation given by the state government as lockdown. Necessities items and other groceries have been given to the poor. Many NGOs and government officials are coming forward to help those people who are not able to come out from their home by providing necessary items. So as far you can say that the governments are taking all precautionary measures to fight against this virus. This is Momita Biswas, DD India, Kolkata.
And as Kerala enters the 17th day of the lockdown, the people of the state have complied with the lockdown norms, and it has resulted in a arresting of the rate of infection. Today on Good Friday, the devotees have confined themselves to their homes watching online church services. Our correspondent Arun Shamnath gets us this report from Thiruvananthapuram.
We are at the capital city of Kerala, Thiruvananthapuram. At Thiruvananthapuram, we are at a place called Palayam. Now today is a very important day. today is Good Friday. Mind you, Kerala has a significant population of Christians, so under normal conditions, this day witnesses hectic activities throughout the state. But since there are restrictions in place due to the war against COVID-19, the place is more or less deserted. Now, not only is it due to the restrictions against COVID given by the government, but it is also the call given by the religious leaders of the Christian community. They have requested the people to go according to the mandates or according to the regulations put forward by the state and central government and confine themselves to their homes. Instead, what they have actually done is they have made arrangements for online streaming of the activities in the church. The state has actually constituted a high-power expert committee. Now, the expert committee has actually recommended a staggered stage-by-stage process of unlocking the lockdown, which means that there will be relaxations in place, but that will be based on a case-to-case basis after identifying the hotspots, probably a classification of regions and areas, and then there will be a step-by-step procedure of going about relaxations in the lockdown. So as a whole, if you want to see, the lockdown is pretty much successful in the state of Kerala, and we are in the right direction with signs of positive developments from the state.
Well, let's talk about Delhi. For mouth-watering Golgappas and North Indian street food, people throng Bengali Market area in New Delhi in Tansen Marg, but as of now it is off limits literally after COVID-19 surveillance teams found 35 workers staying in one landmark pastry shop of the capital. The whole market has been sealed. Our correspondent and my colleague Tapas Bhattacharya gets us this report.
One of Delhi's posh locality, the Bengali Market, has come under the spotlight in the coronavirus case. In fact, this place has been sealed off and has been marked as one of the hot spots by the Delhi government. Remember 2 days back when Delhi government made sure that 20 odd places will be marked as hotspot and they will be sealed. It was not in the initial list. If you take a look at this place right now, you can see that there is a police barricading that is currently on here. Police has absolutely sealed this place. Why? Because 35 people have been found to be staying here illegally. They have been tested. In fact, 3 of them have been found to be positive of coronavirus, and that actually sent the authorities scurrying. They have made sure that nobody is going inside or coming outside of this place. There are some residential people also here, staying here, and they have made sure that each and every individual, each and every household who are staying here will be tested for the disease. That says a lot about the kind of administration that they have been talking about. Authorities are not leaving any stone unturned to make sure that nothing goes wrong in the place. In fact, we've been told that the Delhi police has lodged an FIR, especially against the Bengali Market's shop, especially the one which has housed these 35 people. The way they have flouted the rules and the norms of social distancing has given the Delhi police the idea that it is about time that strict action should be taken against these people who have flouted these rules, and that's one of the reason why we've seen that Delhi police has lodged a FIR against them. The Delhi government especially has spoken about the SHIELD program to make sure that each and every individual stay inside, stay indoor, and be quarantined and be responsible about themselves, and that is something the authorities have been putting a lot of stress on. With cameraman Anil, this is Tapas Bhattacharya, DD India, Delhi.
And my colleague Rama Tyagi spoke to former Union Minister Menka Gandhi, and she cleared the air on whether pets can infect humans with COVID-19 or not. Let's listen to this DD India exclusive report.
Ma'am, there are some reports that some animals, they can also get infected. How worrisome is this?
There have been studies all over the world. The studies are, do animals give or get corona? Now, I'm also a human being. I'm also scared of corona because I'm in that age bracket also, which is dangerous. The point is that I am telling you that there is absolutely not 1%, not 0.0000000%. And the reason for that is, I'll give you the examples. One, coronavirus is a part of the flu virus family. The flu virus has been around for 1 lakh years, ever since the human was there. And every year, the flu virus mutates, it becomes new. The flu I got last year, I get a different flu this year, and I'll get a different flu. And we keep changing the names. We sometimes call it swine flu, we call it chikungunya, we call it something like that. Now this year it's called corona. But coronavirus is a part of the flu virus. And till today, no matter how the virus mutates, no animal has ever got the flu virus from human beings. We cannot give it, we cannot get it. So when this coronavirus epidemic started, the Prime Minister, the President of China, the President of America, and almost every other country, Russia, started doing research. Can we get it from our pets and dogs? After all, that is one area to worry about. So over 3,000 dogs were even experimented on, dogs and cats, by Tanuvas in China, in Chennai, Pantnagar, which is the premier research institution for veterinary sciences, and Haryana Agricultural University. The Vice Chancellor of Agriculture University in Haryana, Dr. Gurdial Singh, has specifically said yesterday that they have found absolutely not even 1% chance that any dog or cat can give it to a human being or get it from a human being. The Chinese research, the research in America, has also confirmed this. WHO has given out a specific notification saying in their research not a single animal can give it to us or get it from us.
So Maneka Gandhi saying that animals can't contract the infection from humans and humans can't get it from animals. So your pets in that sense are safe, but you need to maintain social distancing from humans at least. So do follow that religiously. And that's all the news we have from India. Let's shift gears now and take a look at how some foreign countries are faring with the battle against COVID-19. So stay home, stay safe. The situation is not very good world over. India is relatively still insulated, but that is basically because the lockdown is being strictly implemented. Remember, you are the most important person in seeing that you do not get infected. Stay at home, stay safe. Well, Saudi Arabia, Russia and other major oil exporting countries have tentatively agreed a deal to cut oil production by 10 million barrels a day or about 10% of the normal levels of production starting in May and June, and it could prop up petrol prices that have been affected by the global coronavirus crisis.
These countries have been working together for some years now, but a previous deal of theirs collapsed in March, and it came at a terrible time because it coincided with an unprecedented fall in demand for oil around the world because of coronavirus lockdowns. Most people aren't flying at the moment, for example. So there was a huge plunge in the oil prices down to 2-decade lows during the middle of March, somewhat recovered since then. But some of these countries then boosted their output to try and keep some of that market share, try and keep cash coming into their economies. And so there's been a problem of more supply than demand. These countries knew that they needed to do something. On a video conference on Thursday, they discussed the issue together and came to a tentative agreement to cut oil production. They'll cut it by about 10% of the global market. That's about 10 million barrels per day. It might not still be enough, though, because some forecasts suggest that in May this year, the demand for oil will be about 25 to 30 million barrels per day, lower than usual. So there could still be more supply than demand. This may not be enough to stabilize the oil prices and stabilize the market. But these countries hope that other countries, in particular the United States, might come on board with them and join these measures in an effort to calm the markets around the world. Lucy Taylor in Moscow.
And that's it from me and my team on DD India. We'll see you tomorrow evening at the same time, 7:30 p.m. Till then, stay safe, stay at home. Thanks for watching. Namaskar.
हमारा काम ये है कि हम हिंदुस्तान में कोई भी प्रांत के हैं, हम हिंदुस्तानी हैं और हमारा प्रथम कर्तव्य हिंदुस्तान की हिफाजत, हिंदुस्तान की रक्षा।